There we go. All right, we're back again. Does everybody chronically get kicked out of the meeting, or is that just me? Okay, all right. So what we'll do is we'll see if it stays stable here for a second, and then we're gonna get going. There's some slides that I'm gonna show. Now, if you're just logged in with a call and you can't see a screen, you won't be able to see the slides, but I'll do my best to be able to describe them. So Harley's on the chat. I can see his chat. Harley, can you see my face, my ugly mug? And I don't know if there's anybody else that's, okay, yep, Harley can see me. Now what we're gonna try to do is I'm gonna see if I can share some slides that I have. Let me bring them up real quickly, and then we'll see if we can share these. All right, so I'll keep talking. Okay, now what we're gonna do is I'm gonna see if I can share this. Okay, now Harley, can you see this slide, how to integrate telemedicine? Let me see if I can go. Okay, great. So I'm going to type here, can you, wonderful. Okay, Ruth, you can see the slides. Excellent. Okay, so what we're going to do is we're going to move through some slides here. And then once we get through them, then we will go to, we can take questions. You guys are welcome to, hold on one second. I'm sorry. Can I check it? Aaron logging in as me. Any progress? Yep. So hold on. You guys are being very patient. I appreciate that. And log in as me. Yep. Okay, hold on. You guys are being patient. All right, so what we're going to do is we're going to move through these slides real quickly. Now, one more time, everybody's seeing big, you can see the slides, yes?
I can see them, Aaron.
Wonderful, thank you, Harley. Okay, here we go. So what we're going to do is we're going to talk about how to integrate paid telemedicine. Just disclosure, I do lecture for Elanco and Medici. Matt can talk to you about Televet, but just full disclosure. So what our goals are going to be for tonight is, or the outline, we're going to go through goals, and then what you can diagnose and triage, laws that are currently in place, and then practical steps for implementation. Goals, let me respond to Lisa here. Great. So Lisa's in now too. So the goals that we're going to have is we want to decrease exposure of veterinarians and staff amid the coronavirus outbreak. So that's a new part of our reality, but that's part of what we're trying to do is decrease that exposure where before that wasn't the case. And bear with me. And then we want to decrease the exposure to clients. Through even before the coronavirus outbreak, we want to provide care to patients and then support clinic viability. And in this current climate, that's a big one too, because I would anticipate most people are seeing some drop in the people that are showing up to their clinic with their pets by design, or even large animal stuff. All right, let's go here. All right, what cases can be diagnosed via telemedicine? And this is a common question that I get of, all right, what should I diagnose? What's appropriate? This feels like it's all new. First thing to remember is you're very, very good at telemedicine. You've been doing telemedicine since the day you graduated from veterinary school. I started doing telemedicine when I graduated and worked equine ambulatory. What they did is they gave me a flip phone and they said, doctor, don't ever give out your regular cell phone number. You just use this phone to have a conversation with a client. And when I was going out, what I was doing is they would call me and they'd say, hey, doctor, the horse didn't eat all of its hay this morning. What should we do? I feel like the horse is colicking. I would advise them, okay, give some Banamine, walk the horse, and let's see how it goes. Call me back. That's telemedicine. So that's an equine example, but you can probably think of a million small animal examples. And I always say telemedicine going strong, 140 years and going strong, because you guys have been doing this and you do it very well. So specifically medically, what cases can I diagnose via telemedicine? Well, what condition would you diagnose and remotely manage for a relative? You go, oh, okay, well, that's an interesting idea. So if your son called you up, or your daughter-in-law, or your sister-in-law, or your mother, and she said, hey, the dog XYZ, what should I do? If you feel comfortable managing that case remotely for your mother or for your son, you can probably do it for your client. All right, these are the common cases that I'm diagnosing. Uncomplicated diarrhea. What does that mean? Dog is bright and alert, but has loose stool and has a reason for the loose stool. Oh, well, we fed him, he got into the cat food. We switched his diet. He ate a rawhide, something to that effect. Same kind of thing with uncomplicated vomiting. There's a reason for the vomit. The dog is bright alert and it's not refractory. And when I say those two cases, remember with telemedicine, it's not like there's a hard stop. You're going to, just like with your clients right now, you're going to interact with them. You're going to say, hey, if that dog doesn't improve, if that horse doesn't improve, you make sure you reach out to me, because none of us get it right all the time. None of us do. So remember that with telemedicine, it's just like practice, because it is practice. You're going to continue a dialogue with that client. Uncomplicated otitis. You might say, well, Dr. Smiley, you're pushing the envelope. You can't diagnose otitis. Well, you can. You can look at the ear and you can see if there's erythema. And a lot of times what I will do is I will then ask the client to bring the dog in for one of the technicians or nurses to make a swab, and we actually can send that image back to the client via telemedicine. So I can diagnose everything, and sometimes doctors will say, yeah, but I got to see that tympanic membrane. And if you do, continue to do that. That uncomplicated otitis may not be a case for you to diagnose remotely, because every dog that you see for otitis, you get out your otoscope and you're looking in there and you visualize that tympanic membrane. Keep doing that. In my practice, I don't visualize every tympanic membrane, so I feel comfortable. But if you're I wouldn't argue with you for a second. If you say, hey, Dr. Smiley, I feel like it's best medicine to visualize every tympanic membrane, I'd say more power to you. Arthritis. We can do a lot with arthritis. You can diagnose that. And we're looking right now with Elanco of how can we diagnose arthritis better remotely. So this might be one of those diseases that actually is diagnosed faster, sooner, it's a more sensitive test to do it remotely. That's kind of interesting, because a lot of times clinicians won't think of remote care or telemedicine actually being better medicine, but with arthritis, I think that it actually is. And then fleas. Could you diagnose fleas remotely? So yeah, I could diagnose fleas remotely. What can you monitor? Diabetes, seizures, arthritis, heart failure, allergies, deep pyoderma. Dog has a hot spot. Hey, I want to recheck that dog to make sure that we don't need to continue on the antibiotics. You can do that remotely. Have them take a short video of that pyoderma as it heals after the antibiotics are complete, and then see if the dog needs any additional antibiotics. You're probably doing all of this today. But what you may not be doing is you may not be monetizing it, and you may not be preserving it in the medical record. What does the governor require us to do? He needs us to have a VCPR, and he needs us to get this stuff into our medical records. And a lot of times as veterinarians, traditionally, we have offered our clients a more risky telemedicine. We've said, well, we'll just talk about it on the phone, or we'll text message them, but that text message doesn't get into the medical record. So with technology, what it allows us to do is to be a lot safer and less liable in the telemedicine that we typically offer. Triage. What can you triage? Everything, anything. The doctor, the veterinarian is always better than Dr. Internet. Always, always, always. So when you're thinking about, well, what can I triage? Everything and anything you can triage. You are the best. There's no Dr. Internet. There is no groomer. There is no breeder that would be better at triaging than a veterinarian. What are your requirements? Got to have that VCPR. There's been no change, even with a coronavirus outbreak, in what the governor regulates as far as the VCPR. Well, what's the VCPR? It's that you have seen the animal and the duration of time is up to the doctor. Now, know that who will be judging you is the Veterinary Board of Medical Examiners. So if you say, oh, don't worry, I've seen that Great Dane 5 years ago, they probably won't think that's kosher. Traditionally, we accept it as a year, but if you've got an adult horse, I would guess that the Veterinary Medical Board would say, well, if you saw that horse every other year, that would probably be appropriate, because that horse is going to live a pretty long time. But know that that's where you will be judged, and know that there is no exact amount of time on that, what constitutes a relationship. Got to make sure it's in the medical record. You need to make sure that the platform that you're using is secure. You don't want to use this in I don't know, I'd be leery of Facebook Messenger. I'd probably be a little bit leery of WhatsApp. Those technologies are really, really good, but I always say, Mark Zuckerberg is reading your mail and all that stuff. Implementation, say, okay, Smiley, sounds like a plan. What are we going to do? You got to choose a platform. Some people would just use Zoom, like what we're using right now. Very good, right? It's stable as long as I don't screw up Lisa, because I think I'm the one that messed it up tonight. As long as I don't screw up Lisa, Zoom is very, very stable and it works. Got to make sure it gets into the medical record, all right? And Zoom will allow you to record all these, and then you can just dump that in your medical record. That works. But choose a platform. There's also paid platforms that do a very, very nice job because basically they're secure and all that kind of stuff. So know that there's paid platforms, but there's also free platforms that you can kind of do hacks around if you want to do that. Make sure you start out with having your staff members use it. Use them as guinea pigs. Have them use it, get comfortable with it. Most of this technology is not overly complicated. They want it to be simple for you. In today's age, or not age, but in today's world with the coronavirus outbreak, I'd have a script for my receptionist, right? Think about how much practice has changed in the last week. Now we're not even having clients come into the clinic. Dramatic change. So you can have even though it'd be difficult for your front desk, but change their script. Hey, this is Pam. Thanks for calling ABC Clinic. We offer telemedicine via blah, blah. Can I help you? Email, post to social media, let your clients know that you're available on telemedicine, and then start engaging clients. At the end of the day, we all know it, but the doctor drives most everything in the clinic. So then you're going to be the champion, and you're going to say to Mrs. Jones, hey, Mrs. Jones, let's get you on telemedicine. We want to lower the exposure of coronavirus. This is how we can diagnose and prescribe a whole lot of things. Okay? Just as far as Medici is one of the platforms, they'll offer you a deal as far as if you use that site, if you want to get on their platform. All right, so we're going to stop sharing there, and let's see if I don't mess it up. Heaven help us all. And then I'm going to come back here. All right, so that's my 2 cents. If Matt, do you have anything you'd like to add?
I'll probably say this at the very end too, but the only thing that I want to say right now is essentially that I think that we all have an obligation to be using telemedicine. I would really encourage everybody to think hard, if you're not already on it, about how you're going to incorporate this and what platform you're going to use. But this is in demand right now. This is something that I think socially right now, like I said, we have an obligation to be offering a service that potentially keeps pets and people out of our clinic if possible.
Beautiful. Yep. We want to make this super productive, and I like to hear myself talk, but at the same time, I want to make sure that everybody has the opportunity to ask a question if they have one. Paul, do you want to speak into being on the Veterinary Medical Examining Board? Do you want to speak into the VCPR?
Yeah, Aaron, I appreciate you doing this. I'm just proud of myself to get hooked up to this thing. But anyway.
I love it. I love it.
Don't be laughing, Lisa.
I'm happy for you.
We know at the licensing board, if it's not documented, it didn't happen. So that's my biggest caution is, and you're right, we've been doing a version of this telemedicine for quite a while. Now with electronic medical records, I encourage everybody, put your phone calls in those medical records. What you advised as the next step, if what you prescribe via telemedicine, put a time frame on it. Look, if this patient is not improved in 3 days, I need to examine them in person. That way you've, documented what you've recommended in the way of follow-up if what you prescribed via telemedicine was not effective. I think that's very important, is the documentation.
That's an excellent point, and these technologies are so nice now because they document everything that's going along. And as you're doing telemedicine, remember that it's asynchronous. And a lot of times, as veterinarians, we don't think of it that way. We think, oh gosh, how am I going to put one more thing in my day? And it makes your life a whole lot more streamlined because this entire interaction is asynchronous. Send a text, wait, And you could wait 20 minutes. Sometimes I wait an hour, sometimes 2 hours, and then I send a text message back. So with it being asynchronous, it doesn't have to feel like you have to block out some time for it, and then that entire conversation is preserved. So it's a lot safer.
Yeah, I think the other thing is on the VCPR, seems to me like what I've heard and what I spoke with you earlier about is AVMA is still conservative and kind of holding the line on a physical exam, whereas the American Association of State Veterinary Boards is leaning more towards leniency and extending this to telemedicine. So I think things are going to change rapidly, and I think it is going to vary with the individual cases, but in general, with small animal medicine, we keep throwing this 1 year exam thing around. And the other thing is, I think it's important that it's probably a little risky to do this with a client that you've never seen before, never seen their pet, never seen them. Probably a little risky for a brand new client. I guess I would be a little cautious about that.
Paul, I would step in really quick and just say, certainly from the IVMA standpoint, we're advocating for using telemedicine within the VCPR for sure. Now, interestingly, as you mentioned, there are quite a few groups and now states and territories of Canada who are actively looking to loosen regulations in the midst of the crisis. I think it will be interesting to see how all that pans out and whether some of that stuff stays loose or whatever. But certainly within our state, we should be aware of having a current VCPR and, really trying to focus on using this technology with our patients.
Yeah, I think the new task force, this is going to be a major item or agenda or point of emphasis on the new Practice Act task force. Certainly we got to address this. Telemedicine's got to be a major part of the redoing the Practice Act.
Yep. And so what you're alluding to there is that, just for anybody who doesn't know, is that IVMA does have a task force that has not convened yet, but we know who all will be on it, that is going to be reviewing the Practice Act. And that's one area of many. Another thing that I wanted to just touch on briefly in regards to records keeping, certainly some of the more dedicated telemedicine apps, the ones that are specifically made for this, doctor-patient relationship types of things, they make it an efficient methods for the ability to actually transfer records into the system. I will go a little bit on my soapbox and say that I think as veterinarians, we should all be advocating for these telemedicine apps and companies to integrate with our practice management softwares, because one of the pitfalls that I've had is just sometimes the difficulty of getting those records into the system in a timely fashion, to where there's no hiccups in doctor team communication. Whereas I believe as technology evolves and this stuff actually integrates, those conversations will be updated in the medical records in real time. And so we should all be raising our voice and demanding this of these companies.
We have a couple of questions. Can you guys hear me?
Yep.
Yeah, I can hear you.
Okay. Some fear that this will become 24/7 and they'll get bombarded, and clients will expect an immediate response. Can you speak to that?
Yeah, let me see if I can share this presentation with you again. So if you guys can see this one, watch this. This is nuts. So we've been doing this for a couple of years. Here's when people start consults and here's when they stop them. Now, if I were to give people my cell phone number, that would not be the case. So can everybody see that? So this is time of day. And you get after 10 p.m., it's about nothing. And that surprised me. I was shocked. Now here's another graph. Here's the day. Dadgummit, consults are the slowest on Sunday. Are you kidding me? And it's so amazing because there's value with it in the sense that there's money. And that's, I mean, I'm the most guilty among us of giving things away for free and thinking, oh, heck, it doesn't matter. My expertise isn't worth anything. But when I did paid telemedicine, I was really, really worried that everything was going to get at 2 in the morning, and that was just not the case. So that graph was from 1,300 different cases, and that's not what we've seen. And so most of these technologies allow you to turn it on and turn it off. So you can turn it off, you can walk away. My associate, she turns it off as soon as she leaves the building. I probably turn it off at, I don't know, 10, 11, when my head hits the pillow, then I turn it off. But make sure that you integrate with the technology that allows you to turn it on and turn it off. The other thing to speak about as far as if clients don't get an immediate reaction, what's happening in my case is people are still smart enough to know if their dog is dying, they go to the emergency clinic. So if that dog's leg is falling off and you don't respond right away, they're not going to wait for you to respond because you're probably going to tell them to go to the emergency clinic anyway. But that's just not been my case, that people are like, where are you? They know it's 2 in the morning. So.
Yeah, I would second that. I've really not had people sending me messages in the middle of the night. I would tell people as a vet entering into something like this, think about it in advance and set your boundaries right off the bat. As a relatively new practice owner, when I started using telemedicine, I didn't really set any boundaries. It was just like, I'm going to take anything. And that has bitten me a little bit, but you have the capability of setting those boundaries within these technologies, like Aaron said. And I have had a client express to me that I should have answered them sooner, within an hour or so. But as I look back at that experience, you have a certain percentage of your clients who are more difficult, and this particular client definitely fell into that category. And so I don't think that necessarily she gave me any different of an experience than she would have in the clinic. So that's my 2 cents on that.
It looks like Dr. Couch has raised her hand. Do you have a question, Stacy?
Yeah. Can you hear me, Lisa?
Yes. Go ahead.
So this doesn't necessarily fit with everything that you're talking about telemedicine, but I had a question because things are changing so rapidly up here in Fort Wayne that I'm trying to figure out. As of right now, we have some clinics that are just going to having the client stay out in the car and come in only for emergent and urgent exams. And we have some places that are still open. We're still open. We're asking them to come in one person for one animal, and trying to minimize maximize social distance. But I'm trying to figure out, where are we supposed to be? When are we supposed to be getting to this point? Because I don't know how extreme we're supposed to get. And are they recommending that we go to a point where we don't see clients anymore at all? Or is that a personal choice? What's happening right now?
Do you want me to take this one, Aaron? Okay. We have not, meaning veterinary medicine in Indiana, has not received any direction from the state to close anything down. We have lobbied the governor and other state leaders this week to, if the governor would issue an order, or at the county or municipal level, where they say only essential businesses are to be open, that veterinary medicine would be categorized as an essential business. There has been suggestions out there from AVMA and others that perhaps you minimize non-essential procedures in an effort to conserve any, PPE resources that you may have in your veterinary clinic. But there has been no specific direction as to you must shut down, you can stay open, what you can and can't do. Does that help?
Well, I guess I'm trying to figure out, because if one clinic starts it, then the next one does it, and the next one does it. And if you stay open, then you look like the one who's trying to transmit the disease to everybody. So I'm just trying to figure out if there's going to be any consistency in how they determine who's doing what. Is that just a personal choice? Like for me, if I stay open, that's my personal choice, right?
Right. We've not gotten any firm direction on, what you should be doing in that particular, or what any veterinary clinic should be doing. We're trying to help them, advise vet clinics to stay open, but protecting your staff, whether that's going out, to the parking lot to get the animal or minimizing who comes into your clinic, to keep everybody safe.
If I could just add to that, there's
Yeah.
no firm, anybody telling us you have to do this, but we are getting a steady stream of recommendations from the AVMA, and like for me at my clinic, that's essentially what we're following as our guidelines.
Have you closed down your business then too, to the point where you're just having nobody come in the office, or are you still seeing clients in the office?
Our doors are locked. We have a sign that says you have to call us, and then everything is curbside from there. And
Okay.
probably so and then you have the whole issue of non-urgent versus urgent, which is evolving now. So continue to watch for those updates. That's something that I think my clinic is going to change as of later on next week. But in regards to how all that fits in with this discussion, I have a firm belief, just ethically, socially, that telemedicine provides us the opportunity right up front to start that process of distancing. And there are truly, in my experience, so many things that we can handle without that animal actually having to come into the clinic, and in a realistic, high quality fashion, that this all just goes hand in hand.
Yeah,
So
I agree. I think that at this point, it's kind of hard, like you said, to set up and get everything going in a day's time. So trying to set that all up and go and have us know what we're doing in the first place, it's going to take us a couple of days to get up to speed. So until then, we're trying to get what we can get done and minimize it, like the AVMA has recommended. But we hadn't shut the doors because the AVMA didn't say shut the doors. They just said minimize it to one person at a time, so that's where we're at this point. So, but now people are starting to shut their doors up here where they weren't before. So now I'm trying to figure out, is that something that I need to do too, but I appreciate your guys' help. And I didn't know if Paul could say something to this, because he's up here with us, more, if he had any more idea about what's going on in town or not.
I can speak for our clinic. We are as busy as we've ever been. I think it follows the typical, when everybody else stays home, they seem to think coming to the vet's a good idea. So,
well, they're home seeing all their animals. They're like, well, there's something wrong now.
Well, even for routine stuff, it's, we're just now talking whether we have clients wanting to come in for nail trims and anal gland checks and routine yearly shots, because what better time to do their annual when they're off work? And so it's been hard for us to draw some lines. We're still seeing patients, but we're only allowing 3 in the exam room or in the waiting room at a time, and making them spread out, and only 1 in the exam room, and doing those things. But yeah, the average clinic, I think, is still being asked to do what they do every day. At least in my case, that seems to be what our clients expect right now.
Yeah, we just got notification this afternoon that DuPont it was DuPont, wasn't it? That DuPont has said that they're no longer doing anything inside the clinic. So I'm like, well, that's different from what's been going on. So that's why I wondered.
Yeah, I think my concern is if what they're saying about the situation in Italy is true, we're 2 weeks away from things getting out of hand when it comes to this virus. Maybe there's a false sense of security with all of us right now.
Oh, I'm sure. So, okay. Well, thank you very much. I don't mean to take up all your time. So.
No, you're good. And we'll continue. So continue to watch updates from Lisa, because there'll be more town halls specifically for, so it's a great conversation, and it's very good, because like what we keep saying is we want physical distance, not social distance. So I appreciate the conversation, and know that we're working overtime at IVMA to make sure that these kind of town halls virtually continue to exist, and with different topics, so that we can flesh this out, because it is so fluid. Stacy, the only thing that I would disagree, or not even disagree, but I would encourage you to know that you can get up and going within 24, 48 hours, genuinely. So do not say, oh, geez, this is so difficult. We probably don't want to add one more headache in telemedicine. No, it's going to relieve a headache. So it's just not as difficult as you think because you're so good at it. So it does not take that long because you're doing it all the time.
So Aaron, I have a question for you. How was this transition? Because you're correct. I mean, I've been doing lunchtime, after hours, Saturday, you name it, basically free telemedicine for 30 years. And so when you start to implement a fee for these consultations, how did that work in your practice? How was that transition? When
we made the transition, it was so much more difficult than it is right now. Clients are more than willing to pay, right? So I'll answer the question. What the transition was is the transition to the client was, hey, Mrs. Jones, this is more convenient and less expensive. And she said, what do you mean? I said, well, you can bring the dog back in for a recheck, or you can do it on telemedicine. It's half the cost. Oh, I'd rather do that. So that's how we got it. And then the other thing, as far as for the hourly worker, so whether you're up in Fort Wayne and the guy is going into the GM factory to work, when he has to take off from the factory to come to the vet's office, that's really expensive, even if you give him a free recheck. And that's where it really opened my eyes up. This is more convenient and less expensive. Now, right now, in this current reality, anybody, no, it's super easy. You just say, hey, we're doing this. We're physically locking them out of our clinic. So telemedicine is not only easy, it's in demand. If there was ever a time, like what Stacy was talking about, like, oh, geez, should I add one more thing to my plate? If there was ever a time to unpack paid telemedicine, it's today.
Now, the system you have set up, do they pay online? Is that how that works? Or do you send them a bill, or how does that work?
If anybody is specifically interested in the different ones, we can do that. Let's hit Dr. Connor's question here, and then we can run through the specific features of the different technologies, because Matt uses one and I use another. So it's nice that we have that diversity.
Okay, great.
Dr. Connor asked, can a relief veterinarian practice telemedicine for you? The relief vet could keep your practice viable in case of your illness.
All right. Dr. Connor is super smart, and she works relief at our clinics, and she's great. And this is one of the difficult things as far as in the Practice Act, and one of the motivations as far as for us to review it is because relief veterinarians are such a gray area. In the state of Indiana, we have specific protection for relief veterinarians from the VCPR. And you're like, oh, Smiley, don't talk like that. It doesn't even make sense. But it's true. So the relief veterinarian, if we take telemedicine, so let's rewind the clock 15 years ago, so if you're a solo practitioner and you are required to have some other veterinarian that your clients can call, they do not have to have a VCPR to speak into your client's problem. You just blew my mind. So I would say, to Dr. Connor's point specifically, the Veterinary Medical Examiner Board has never looked at this because we haven't seen the integration of this kind of technology, but it's very much of a gray area. And I don't know, if you're willing to push the envelope, there would probably be leniency put upon you as far as in this coronavirus. But if I'm talking strictly as far as with my hat of the president on, I would say I'm not going to push the envelope, but it's a very, very valid question. And there are a lot of loopholes in the law right now in regards to relief veterinarians.
Any other questions anybody wants to post on the chat line?
I think, Aaron, as far as a relief veterinarian is concerned, I would expect that us on the board would view that the same as an associate. In other words, if my associate follows up on my case or gives advice over the phone on one of my cases on my day off, I think we would view the relief veterinarian in a similar light as to an associate that's in our practice. I would hope.
Beautiful. So Dr. Connor, that's probably the best. That's straight from the horse's mouth.
Okay.
I can.
Any other? Yeah.
Yeah.
Go ahead, Matt.
While we're waiting for some more questions, please, everybody, throw some questions at us. We got 20 more minutes or so if we get them. I would just speak to sort of the transition, that concern of like, how do we get this up and running, and how do you get clients who have potentially been contacting you through text or email or Facebook or whatever it might be, for so long. I would echo what Aaron said in terms of like, this is the time, seize it and take advantage of the fact that people want this and people recognize that they're not going to get into our clinic for a while anyway. And so why not stay at home and have a conversation with us? You know, in addition, it is so in demand that cost doesn't really seem to be an issue. 2 years ago, when I got onto telemedicine and was sort of like on the sort of an outlier and an early adopter, there was sort of this sense that we have to charge way less for telemedicine than we did for an in-person physical exam. And that is not the case right now. You can be much closer to your in-person exam or there's you know, sort of rumblings of veterinarians who are potentially charging a little bit more for telemedicine because it is such a highly in-demand service that takes a little bit extra cost and overhead for you. And so, you know, why the heck not, you know, charge again appropriately for, you know, what goes into that service. You know, for me, 2 years ago, the transition was all about, you know, this is, you know, again, as Aaron said, it opens up access, and again, it's more cost effective. We really highlight in a low stress handling facility that it gives you an opportunity to diagnose some things without causing all the anxiety of an in-clinic visit. So, you know, those are the kinds of things that we really stressed. And then again, you know, with the new apps and improvements in integration, you just continue to have this improved ability for communication with medical records. So those are the kinds of things that we highlighted early on. Right now, though, it's all about the pandemic. This is what we're doing, so get on board.
Great. We had another question. Do the third-party apps allow for real-time video of exams? This would work great for curbside service when the pet is taken from the owner, and the exam would be done without the owner present.
Yeah, so you could use FaceTime. You could use all sorts of technology to do that. You'd want to make sure that it's secure, and then you'd want to make sure that you get notes in the medical record of what you saw. But absolutely, you could use FaceTime. So you wouldn't have to pay a nickel to do that, but it's a great idea. Hey, Mrs. Jones, turn on FaceTime. You're going to walk in there with the doctor. That doesn't cost you a nickel to do. Now, if you use one of the telemedicine apps that you're paying for, what they could even do is start the video before you ever get there. So Mrs. Jones calls up and she says, hey, I got an issue with my dog. Oh, hey, send us a video of that. Let's see if you even need to drive here. But Dr. Connor makes a great idea. Use FaceTime. It's free.
Another question, what is a typical monthly fee for using Medici or maybe any platform?
The Medici fee, that link that I put it there, reducing their fee for the coronavirus outbreak. So they're charging you $99 per month per doctor. And then Matt can speak into Televet.
Televet is right around $60 per month per clinic. Televet does allow for, as far as I know, unlimited users under the clinic account. So it is currently one of the more affordable ones.
Paul, what I can do is I can share my screen and show you a couple cases on Medici, and I think that this would be very similar as far as any platform that you use. All right, so what we're going to do is let's see if, okay, so you guys can see that. Let me see if I can take you to, let's see what this does. Okay, so this is a case. All right, let me hit, and all right, here we go. See if everybody, yell at me if it doesn't work. Okay, so this is a case that I got a couple days ago. Sorry that it's not real clear. Let me see if I can make it. This is gonna look ugly, but okay, you guys don't care. At least I don't think you do. Yeah, we care, Aaron. All right, so here we go. So this is just a screenshot of my phone. All right, here we go. I'm opening it up. Let me make sure I didn't mess anything up. Lisa just sent me a text. Okay, so Scout's leg has a growth, and now we're in Corona, right? This is in the midst of Corona, so I don't want to see anybody in the clinic. I want everybody to do telemedicine. Come out when we take the walks, usually scrapes it, it keeps bleeding, all right? So then we start going. I say, send me a picture. And what's incredible about right now is how great our phones are. The dadgum cameras on there. It's like we've got a telescope on our phone. It's incredible. So I open up the picture, I zoom in. Boy, you can tell that dog's been licking. It's just amazing, okay? So then what I'm gonna do is I'm gonna say, good job with the picture. Can you send me a video? She says, yeah, I'll send you a video. Son of a gun, look at that. So I can really get a lot of perspective. And I say video, video, video. Now here's what you can do only to the colleagues. So I have my nurses on here and I say, how old's this dog? They give me the weight. I say, how old's this dog? And I'm talking to my nurses. 2 years. And she said, oh, I'm sorry. I thought you wanted the weight. I said, laugh out loud. Then I tell the owner the mass appears to be a histiocytoma. They're benign. They go away on their own. Then I ask the staff, can you send this owner a link? And then the owner says, well, it's been there for about 3 to 4 weeks. This is my staff. It's Shelby, she says. It's a histiocytoma, and here's a link. All right. I said, let me know when you read the article. And then she said, would you suggest to see, oh, I got a text from Lisa. If it goes away or if licking it pretty frequently. I said, I tend to wait for them to go away. Oh, he's fine with it. All right. Does he constantly, I know this is going fast. He's a really big licker. Okay, we can remove it. I said, try a cone. All right. And then, so what we do is I say, let's have that be the plan as far as just ignore it. Now, at that point, I was charging 35. Now I'm charging 60. And then this is the end of the consult. I make my notes. This all then gets pushed into the medical record. So that was really quick and dirty, but that's just, and you guys are doing that kind of stuff all the time. So all I did, but I avoided that owner coming into the clinic. She saved tons of time. She saved money on that one. Now my telemedicine fee is the same as an in-clinic fee, but she loved it. Now, do I know that that's a histiocytoma? No. But what would I have done if that dog was in the exam room, that young of a dog? I would have looked at it. I would have said, nah, it's probably a histiocytoma. I'm not going to cut that thing off right away. So if you look at every eardrum, if you cut off every histiocytoma, keep doing it. Keep practicing medicine the way you practice. But that might generate a couple questions too, as far as after watching that consult.
Yeah, could you speak to the liability piece of that, Aaron or Matt?
Yeah, you bet. So I always say that paid telemedicine with these latest technologies reduces our liability dramatically. It reduces your liability dramatically because I didn't have to take the owner's description of what that mass was. I looked at it. I could see it. She sent me a video. I could get perspective. So that makes it a whole lot more, I'm a whole lot more comfortable because I can use my medical judgment. Personally, as far as the platform that I use, they give me $1 million of liability insurance per case. So now I'm super comfortable that even if I do duff it, I've got that insurance.
So Aaron, that video is attached then to your medical record.
That video lives on their encrypted platform. The conversation gets put into the medical record, but the video, I can go back and access that video through the app anytime I want to. Those files are so big when they get to that video that that doesn't live inside of Avamark. But what I do is I've got a code, and so I can go back to that client. So if I was in front of you at the board and you'd say, all right, Smiley, show me the video, I could produce it in a snap.
Okay, that makes me feel better.
A couple follow-up questions to that. Do clients get charged for that? Is the payment collection 100%?
I can speak a little bit to that. There's a couple of different systems. So I have used both Medici and Televet. Medici has a couple of different payment sort of plans, one where you pay per month, and then they take nothing out of any of your other fees. So you do get out of any of those consults, 100% of that, whatever your fee is, goes to you. The other payment tier is that you don't pay anything per month, but then Medici does take a certain percentage out of each fee. On the Televet side of things, whatever we set our fee to, Televet adds $5. And so if we get $45 out of that consult, the client is actually spending $50, and $5 of it goes to Televet.
The only thing that's different on the Medici platform is they don't offer a percentage anymore, so everything's just a straight subscription. So I pay my subscription, and then they take out a credit card processing fee. So, and they have on the app, you can keep track of exactly what's going on. I'll see if I can show you. I might be able to do this real quickly. So they have a little thing on the dashboard. Stand by. So like this is, all right, so this is what it looks like. That's what I've done this month as far as in telemedicine, right? So the little negative there is credit card processing fee.
Good. As a follow-up to that, what if you don't have electronic records? Do you have to write that whole conversation down? How does that get married?
No, you don't. And that's the beauty of it. You can print it out. It's a PDF. So what you would do is you got an electronic document. You can hit print and stuff that in your folder. Oh my gosh, it's beautiful.
Cool. Any more questions anybody wants to put out there? Any follow-up from Dr. Smiley or Dr. Cantrell?
I'll go first, and then Matt, you can end it up. What I would say is if any IVMA, if any IVMA member, everybody on here, if you have specific questions, if you want to, hey, I'm going to ask Matt about Televet and I'm going to ask Aaron about Medici, I will answer your telephone call because you're an IVMA member, right? So if you're like, hey, okay, he said I could get started really quickly, but I don't believe him, but he's the president of the IVMA, guess what? I'll pick up the phone or I'll answer your email. So take advantage of the fact that you pay dues to the IVMA, and the IVMA has, and I'm going to brag on Lisa and I'm going to brag on our organization. We are set up for these kind of crises, right? Because IVMA has been talking about telemedicine for 3 years. These Zoom calls, Lisa's got this stuff rocking and ready to go. So take advantage of your membership, because if you are in Illinois, Lord knows this isn't happening, right? It's just not. So if don't ever feel like you're a burden, take advantage of the fact that you've got a great association.
And you can send emails to info@invma.org too.
Yeah, and I totally agree. Just since last night's Q&A session, I've talked to 5 different people and just sort of given them my opinions and tried to help them kind of make some decisions. And again, I will echo what I said at the very beginning, that in the midst of the corona pandemic, I really feel like we have an obligation as veterinarians to try to get on board with telemedicine and try to use it to its potential to distance ourselves from our clients, at least for a period of time.
Matt, can you help me a little bit here? Just give me a quick, brief update. I've been trying to follow the AVMA guidelines, but just quickly speak to what they're recommending and what you're doing in your practice right now to kind of help Dr. Couch and myself.
Yeah, so to my understanding, at this point, AVMA is recommending that we go to urgent care only, essentially, and that is not strictly defined, but they are recommending that we delay elective and wellness visits for this period of time. And I think a lot of that, you know, again, there's the distancing part of it, but also when you talk about procedures, there is a very real need at the moment for conserving PPE. So that's, you know, sort of the basics of it. And that's why I think a lot of us have gone, you know, in terms of distancing, you know, a lot of veterinarians have gone to, you know, essentially locking the door and curbside care only, not allowing clients into the clinic. And that's to protect, you know, our teams more than anything, to keep ourselves healthy so that we can still be there for urgent care. But again, that just within, I think, the past 24 or 48 hours or so, that recommendation of putting off elective and wellness care has come out from them.
And are you wearing some PPE when you're examining these animals, because there's speculation about them acting as fomites?
So far, the only reason for us to potentially wear PPE is if we understand that there has been a possible exposure in that pet's or that animal's family life. If there is no evidence of that, if nobody tells us about that, then we are not wearing PPE.
So you're just doing the hand washing and that sort of thing?
Yes, certainly, yes.
And are there clinics in Indianapolis following suit? Do you know? I mean, is that becoming the standard now?
From my point of view, the circles sort of that I understand and the people that I see on social media or wherever, yes, that seems to be becoming the norm down here in Indianapolis. What about you, Aaron?
Yeah, same thing. What we did is we put a blue, we're in Anderson, and the clients, most of them were geriatric that are coming in. It's out of control. And so we were worried about tripping and falling and confusion. It just blows my mind. So we put a blue line around the front desk. And what we have is big signs, please stay behind the blue line. But in us trying to keep people out of the clinic, it was not, people couldn't understand it. And it was more confusion and more upsetness. And so it was a very strange thing, but we just have to adapt to who our clientele is. And it is amazing. Like Paul was talking about, I mean, old people on oxygen were coming in. It's like, stop it. Literally oxygen.
Okay, we had one last question. Are there any further leniencies for re-sterilizing gloves or other PPEs?
Not that I know of.
Yeah, not that I know of either. Again, this is why Ivma's been sending out and will continue to send out emails daily as these things continue to evolve and change, sometimes by the hour, sometimes by the day. So definitely stay, connected to the emails each day. Okay. Thank you, everybody. I think we'll wrap it up. Appreciate your time.
Thanks for tuning in.
Thanks, Lisa.
Bye. Bye-bye, everybody.
Bye.